Hi everyone, in today's lecture, some of you might be a little squeamish with the topic because today we're talking about mucus.
Oh my goodness.
Starting right now. Hi everyone, when you look at the components of asthma and bronchitis, there's the inflammation, the constriction of smooth muscle, but then there's the production of mucus. And that's the topic of today's video, is how to help your patient or your loved one get that mucus up when they can't do it.
I like you.
Here's a few strategies we can employ to help them. First strategy is addressing the other two problems, the constriction and the tightening. Is the patient taking their inhaler? My brother who has asthma, I'm talking to him on the phone, he's hacking up. I'm like, didn't the doctor give you an inhaler? He's like, yeah, but I don't use it. Step one, use the inhaler. These drugs open up the airways so we can actually help get that mucus out. Second strategy, hot showers. Yeah, that warm, moist air gets in there and helps mix up with some of the mucus, help to break some of it loose. Next strategy, percussion. If they're coughing, cup your hand, gently tapping them on the back. And this is in an attempt to loosen some of the mucus that's in their bronchioles. Try to dislodge it a little bit so they can cough it up. Next strategy, a Flutter device. Yeah, you may see these in the hospitals, or if you have someone with bad bronchitis, ask for one of these. But these devices, the patient's going to inhale, blow out, and as they're exhaling, there's a little valve that slams shut. So it's like a little vibration coming back into the lungs, and it's those air vibrations that are supposed to help loosen that mucus so they can get it up. Okay, so a Flutter valve device. Ask your doctor for one of those. Okay, now probably the most beneficial technique to help someone get mucus up is encourage them to use low to medium velocity coughs. That's right. You've heard them before. They're hacking, they're straining, they're pulling intercostal muscles. They're coughing way too hard, way too fast, and the air is just blowing past the mucus. This is difficult. But the technique you want to use, less coughing from here, it's more of a clearing of the throat. Ooh. Now, as I'm filming this, I just tore up a bunch of facets in my back, so it really hurts. And I have asthma. So whenever you hurt your back, the spine, there's a protective mechanisms. When the spine moves, the muscles will come around and tighten up to hold the spine in place. Those are called spasms, and they are muy painful, just horrible. So when I cough, I get that spasm and it hurts. And literally, I've been sleeping 20 feet away from here in my studio in a chair for the last week. I found out that low velocity coughs are fantastic.